Advocacy for medical malpractice victims is made up of lawyers, doctors and other health professionals. It has been championing justice for medical malpractice victims through the payment of compensation, promotion of high competence among healthcare givers, among others. It receives and investigates between 25 and 30 cases of alleged medical negligence nationwide every week. Executive Secretary Kwame Brobe Appiah says the organization is overwhelmed by the rising cases of medical malpractice. His organization has a 60% success rate of reported but investigated cases.
The incidence of medical negligence, so far as organization is concerned, is on the high. On the average, we have a minimum of 25 to 30 cases coming through. And we listen to the narratives of these patients, assess the complaints they come with, and then we're able to make a determination as to what to do to help them seek compensation or to seek justice. So with respect to the high number of cases coming up and then the huge amounts paid as compensations, I think it's as a result of the awakening that has come to bear now, because patients are getting empowered by the day. They are getting to know their rights as they also want to exercise their responsibilities. And I think the more we keep on this trajectory, the health sector would set up and then do the needful.
The work of Mr. Appiah's organization appears to be impacting negatively on the Ghana Health Service, as huge sums of money are doled out in compensations to victims of medical negligence.
We have been very successful. I can say that on the average, maybe 55 to 60%. So we've been successful, and others too have been settled out of court. Sometimes when you approach the health facilities, they admit that they have been at fault, and so then they would want to compensate the patient. There was one case that we worked on that the facility was a private facility. They actually paid something close to about 400,000 Ghana cedis. Well, in that case, it involved a little girl that had gone to the hospital, and they did a surgery that went wrong, and then eventually the child couldn't do anything again in terms of mobility. She could not move, she could not see, she could not hear, more or less like a vegetable. So it was quite a severe case, and that necessitated a settlement out of court. We have cases in court in about 6-7 regions.
Ashanti Regional Health Director Dr. Emmanuel Kojotinkran wants attitudinal change to curb growing cases of legal suits against the directorate.
Past 2 months, I've been on a crusade, visiting all the health centers, trying to see how best we can address the attitude of health workers as far as their work ethics is concerned. And Cecilia will tell you, we were also health workers, we were all in public health in a government institution, and the way we were doing our work is quite different from the health workers we see today. There was a lot of commitment, a lot of hard work, and a lot of right attitude. But you don't see it this time like that. So sometimes I'm saddened, because recently we've had a lot of legal cases. People are not happy because of the services that we've rendered to them, and then they go to court. And then if you are not lucky, they will put judgment debt on the hospital.
From Kumasi, for Joy News, Oimintiria reporting.